During the warmer months of the years, dogs and cats may be susceptible to heat stroke, certain breeds being especially vulnerable. Heat stroke occurs when a dog or cat's internal regulatory mechanisms cannot maintain a normal core temperature of 101 to 102 degrees Fahrenheit. When the animal's core temperature rises above 105 degrees, all body systems begin failing rapidly. This situation is truly an emergency and requires a pet owner's quick intervention to expedite cooling and prevent permanent organ damage or death. Heat stroke can occur in all pets, especially brachycephalic or pug-nosed breeds, and long-haired animals being especially vulnerable. Obese and elderly animals are also more prone to overheating. High humidity allows heat to transfer through the skin more easily. Leaving a pet in an unventilated automobile is a very common cause of heat stroke. The temperature inside a closed car will reach 102 degrees in 10 minutes on a sunny 85-degree day. In 30 minutes, the car will reach 120 degrees or more inside. An animal suffering from heat stroke may be standing listless or lying on its side unresponsive. It will be hyperventilating or very rapidly panting and have thick, ropey saliva hanging from the tongue and mouth. The gum tissue and lips will, however, be tacky and dry. The gum color will be blood red early in heat stroke and turn gray-blue as shock sets in. Seizures occur as the brain overheats and cascades of physiologic breakdowns occur. If it is possible to take a rectal temperature, it may reach 106 degrees or higher. The pet must be cooled quickly and taken to the veterinarian as soon as possible. It would seem logical that icy cold water would be the best choice to cool the pet rapidly, but it will actually cause capillaries at the surface of the skin to close. The circulation is already compromised during a heat stroke, and cooler blood will not return to the core as quickly if very cold water is used. Instead, room temperature water is more effective. Concentrate on the trunk and the head. Do not try to force an animal in a heat stroke to drink water. It'll only aspirate into the lungs while panting or cause vomiting, which leads to further electrolyte loss. Take a rectal temperature often and stop cooling when the thermometer reads 103 degrees. It'll continue to drop. Towel the excess water from the coat and allow the pet to air dry. Most importantly, get your pet to a veterinarian immediately. It is always better to prevent heat stroke in the first place. Always provide fresh water and shade and moving air if possible to an outdoor pet. Remember that working breeds and enthusiastic dogs will go until they drop. Keep this in mind if jogging with your dog or throwing the frisbee on a warm, humid day. If possible, exercise with your pet early in the morning while it's cooler outside. Never leave an animal in an unventilated vehicle for any period of time. Partially rolling down the windows in a car will not provide enough ventilation, so it may be best to leave the pet at home during the warm seasons of the year. If you have any other questions concerning heat stroke, please discuss them with your veterinarian.